Welcome to the Redemption Physical Therapy Podcast, a podcast that helps you move better, recover faster, and perform stronger. Today, we are going over the 5 most common mistakes when dealing with a muscle strain. So, that quick outline is we'll go over the definition, how it happens, common causes, how to know if you have one, and then healing times, and then finally, we'll get into the 5 mistakes. I'm Frederick, and
I'm Marissa.
let's get right into it. So, what is a muscle strain?
So muscle strain, specific to a muscle, right? Not to be mistaken for a sprain, which is ligamentous.
Okay.
Usually occurs when the muscle is overstretched in some capacity, whether it's overstretched too fast, maybe it's overstretched in a position that your body couldn't handle. It could be in a stretch position and overloaded. The main thing is that it's overstretched. When it becomes overstretched, the fibers of the muscle, they either get irritated, inflamed, or they can get torn as well. So that's where we'll get into the degrees of muscle strain.
Gotcha. Okay. So what happens? Like, how does it actually happen?
So specific, I mean, like to a sport or something like that. I mean, it could happen, let's think of like a very fast twitch sport, sprinting, right? So as they're coming through with their leg, right, their hamstring is getting is being stretched.
Mhm.
Maybe it happens so fast, or maybe there's something going on in their life, or maybe they have some sort of imbalance or whatnot. But that one time that they're stretching out their leg and their body can't handle it, then that strain can occur. Hopefully, it's not a tear,
Okay.
but it's that strain will happen.
Gotcha. So a strain can be an actual tear or just some irritation. What's kind of like the difference between those two?
So there's grades of muscle strains, right?
Mhm.
Typically, it's a grade 1, grade 2, grade 3.
Mhm.
Grade 1 tends to be just like your typical tweak, right? Your
Mhm.
strain. You have overstretched the fibers. Could there be micro tearing? Maybe, right? But we're looking more at inflammation, right? We're
Okay.
looking more at these things are irritated, they're overstretched. There's certain things that we can do to make it better. But that's your grade 1. Grade 2 starts to move in there. Now there is tearing that has occurred. Grade, and it's not usually a full rupture of the muscle, but there is partial tearing, or that micro tearing becomes a little more evident. You tend to have some bruising with grade 2s, right? Still maybe not a candidate for surgery at grade 2, maybe not, but there is some partial tearing that has occurred. Grade 3 gets where it's a little more complex,
Mhm.
because then you might have some full tearing, or we've heard of like the muscle kind of tearing off the bone type deal.
Yeah.
These may be candidates for surgery, that type of thing, depending on what else is holding on. But yeah,
Mhm.
that's the typical 3 phases.
Gotcha. Okay. Got it. So on these 3 phases, with that, what are the kind of like just a brief summary of the timelines that it may take to heal like a grade 1, grade 2, grade 3?
Grade 1, and pending that you're doing everything appropriately, and you're getting help to heal the injury, you might be looking at 3 to 6 weeks or so, in a sense, depending on, because at grade 1 there's a spectrum. Just because there 2 weeks, there might be a really really insignificant strain that heals really quickly, but you could also have a more significant grade 1 that hasn't torn but is more irritated, and more overstretched. So I'm looking at kind of like a 3 to 6 week range, likely for grade 1s. Grade 2s, those are going to take a little bit longer. Those are where we really have to allow for some healing to occur, before we really start to load and kind of get them back to what they're doing. So you're looking at more for grade 2, kind of like that 8 to 12 week mark is probably a good thing to keep in mind when it comes to the grade 2. Grade 3, pretty dependent. It's dependent on the severity of the injury. It's dependent on whether or not it needed surgery. Grade 3, you're looking at more like months of therapy, probably 4 to 6 if you're not getting surgery. If you are getting surgery, that changes the timeline. And that's based on the muscle, because there'll be a lot of things that you can't do initially because we can't rupture that repair. So grade 3 gets a little more dependent on the condition.
Mm, gotcha. Okay. So with that brief overview, let's get into the 5 most common mistakes. So mistake number 1 is ice. So explain that a little bit.
Yeah.
So
I mean, if you've followed my Instagram for any length of time, you know how I feel about ice. Um, So yes, we used in the back in the day, rice was a thing,
Mhm.
ice compression elevation, rest, ice compression elevation. Even the guy that coined that has gone back on the ice part. We have found that icing an injury will delay healing. Why does it delay healing? Because it shuts down the blood flow, which is the only means of getting healing nutrients to the area. So we've demonized this inflammation process because it is painful. Inflammation is not great, but inflammation is the body's way of healing, right? So to shut that down, especially immediately, can have pretty negative impacts on the rehab process.
Gotcha. And just for some clarity, so it's not like completely shutting it down, right? Because if
Yeah, then you
just to-
lose a limb.
yeah, right. Just to make sure people know that we're not saying it's complete shutdown, so you don't be like, oh, what? No, there's no way.
Yeah,
Um, just for that clarity's sake,
slows the blood
it
flow.
slows that
Yep,
down, right?
yep, there you
Okay.
go.
So when are some times when ice may be necessary?
So,
Right.
as me as a treating physical therapist, I have used ice if I'm having a hard time managing the swelling, right? So I give the swelling like a week or two to kind of do its thing. And with techniques, because we don't want stagnant inflammation,
Okay.
right? So as they come in and we're working through things, I'm trying to push kind of old inflammation out and maybe bring new inflammation. And we say inflammation, new blood flow into the area,
Okay.
right? Um, if I'm having trouble controlling that after a couple weeks, let's say I have I don't know, like a knee that's the size of a basketball.
Yeah.
That's we got to control the swelling at some point.
Right.
So that might be something like a last ditch effort.
Okay.
I've also used ice in the setting of if I am trying to do something that maybe is a little bit of a painful technique. I have kind of dulled out some of the pain receptors with ice, kind of
Yeah.
numbs it out. If it's like something like, hey, we need to get this range of motion, that's a little less common of a technique for muscle strains,
Yeah.
but that's another reason I might use ice.
Gotcha. Okay. So there are some times, but it's not the first
Absolutely not.
intervention. Got it.
Never.
So what do we do instead? If we can't ice it or if we're not going to ice it, what do we do instead?
Yep. So it kind of leads to like another mistake. Like what we don't do is rest,
Mm-hmm.
right? So we don't want to completely rest this muscle. We want gentle movement, right? And gentle movement, appropriate movement. This is kind of where the professionals in your life come into play to let you know what is appropriate and what's
Mm-hmm.
not for that specific muscle and what not. But we do want movement, right? And that's also going to help to not allow that inflammation to get stagnant. So maybe it is just getting on a biker and just like slowly moving. A movement produces blood flow and lymphatic drainage and circulation and whatnot. All these things we need for healing.
Mm-hmm.
So that's one thing instead of ice is to actually move
Move.
the area.
Okay.
Yep.
And we'll dive into that a little bit more
Mhm.
as we continue to go down. And to kind of clarify with this whole blood flow thing, what we're saying is obviously the blood carries all of those nutrients that we need to heal our injured area. So when we're saying increase blood flow, shut down blood flow, reduce blood flow, that's reducing all the nutrients that we're getting in our body, oxygen, everything that is required to heal that specific area. So I've said this to many of my patients all the time. I'm just like, yeah, so we're just trying to get more blood flow or improve the blood flow. And they're just like,
My blood's not
okay.
flowing.
Right. Or they're just like, oh, okay. What do you mean? It's like, okay. So your blood carries all these things, okay? And then it also carries away some things. So we're also trying to carry away all the debris, all the things. We don't want those things to stay in that area because it's a lot of damaged tissue. If it stays there, that's when that swelling, that inflammation can stay there for an extended period of time. So we want to get that out of there. So that's just a little clarification on what we mean by blood flow. Now, going into the next point here, or the next mistake, is stretching.
Mm-hmm.
I see this way too often when people get some type of injury or strain, for instance. They're just like, ooh, I need to stretch. Or people think, I just need to stretch more. That's the reason why I got injured. But in this case of a muscle strain, why is stretching a mistake?
Yeah, I mean, it's specific to a muscle strain. It can be very detrimental. I mean, you think of back to our definition of what a muscle strain is. It's an overstretch. So, whatever the capacity of overstretch, stretched too fast and loaded to whatever, it is overstretched. So those fibers have now overstretched. What we don't want to do is further stretch them,
Hmm.
before they're able to heal back to their normal state, right?
Right.
And I mean, it's hard because I think a symptom of muscle strain, it almost feels like a cramp sometimes,
Yeah.
and I feel like that, like people think cramp and they're like, oh, I just got to stretch it out.
Yeah. Yeah.
Which I don't even know is effective for cramps either, but well, I digress. But yeah, so we don't want to overstretch an already overstretched muscle. When you think of it that way, it
Right.
makes sense. It sounds simple.
Yeah. It makes sense.
Yeah.
And that's why we're clarifying the whole entire process for you who you just don't understand like the mechanism behind it. So once you understand the mechanism behind it, you can better tackle your strains with a smarter approach, basically. So some might ask, is there a time when I can stretch it? Because it just feels tight. I need to stretch it. It feels tight.
Yeah. So, I'm a huge advocate for dynamic type mobility, right? At any phase, right? So even if I have a newer hamstring strain, for
Mm-hmm.
example, we might be doing some like lower level dynamic mobility, hamstring flossing, that type of stuff, because
Mm-hmm.
you do, that movement, like we talked about, that movement that instead of rest, it does help to, as the fibers do heal, it helps to remodel them, because they're going to heal pretty disorganized. They're
Yeah.
not going to heal like a normal muscle tissue.
Yeah.
Slight stretching, flossing, I like to
Yeah.
say dynamic mobility,
Yeah.
movement. That's what, as we allow it to heal, it's going to allow it to heal in an organized manner, which is the way it's supposed to be.
Got it.
Right. So we might not be, maybe not the first week are we doing these things, but pretty immediately we want to make sure that we're also maintaining mobility in that muscle. We want it to heal correctly, and we also don't want it to get stiff.
Right.
Scar tissue will form, and that's great, but if not controlled, scar tissue is going to act like glue in the body,
Mm.
right? And we don't want that. That's just another issue that we have to worry about down the road.
Yeah.
So, and the stretching, the range of motion that we're working within that dynamic mobility will increase over the weeks. And that's just dependent on how the person is responding to their current therapy.
Gotcha. Okay. So, kind of clarifying that point of dynamic mobility a little bit more, just expounding on it. If you didn't catch that, really, if you think about movement in general, that's dynamic mobility. So if you got a hamstring strain and you're bending over to tie your shoe or touch your toes or whatnot, you're moving through a range of motion and your upper body is the load. So you're actually doing dynamic mobility. So things like that, that's just a simple example. The same thing if you had a quad strain, for instance, and you just extended your leg out, and then once you're bringing it back in, it's stretching out again. And that's dynamic mobility. So really movement can be dynamic mobility without it being some specific drill, right? So just think of movement as dynamic mobility instead of a static stretch that you're just kind of sitting in for an extended period of time, because really all that does is just gives sensory information to the muscle after a while to just relax. It's passive, because once that sense goes away, it's going to tighten right back up, and it may even tighten up even worse. And then again, like we talked about, you may stretch out that fiber that is trying to connect back together in a first disorganized manner, but then also the organized manner from there. Okay. And then that whole disorganization, if I can give you an example, is like having an intersection. You got a four-way and things are jammed up in that intersection. But then just think about, you have a two parallel lane road. So you got two cars going down either the same direction or opposite directions. But either way, the parallel is going to be the organized and the intersection is going to be the disorganized. We want to get back to parallel after a while, because that's how our muscles should be sliding and gliding and moving. So that way we don't end up with nice jumbled up scar tissue in those areas that restrict range of motion after a while, and just make our movement just way more challenging and the healing process a lot slower. Um, Anything else you want to put on
No, that was
that
good.
point?
Yeah.
Okay.
That's where, tendons are weaker when they are disorganized.
Yeah.
That can become a problem.
Right.
That's why some of these things can turn into ruptures in the long term.
Mm.
Yep.
So with the stretching, we already went over dynamic mobility is something that you should do instead of stretching. And like we explained a little bit more, it's just really movement in general with intolerance, right? Um, and then the next thing, let's get into that. So the next mistake is completely resting.
Yeah. So, I mean, we talked a little bit about it, right? But yeah, that complete rest. I mean, honestly, with any injury, it's not recommended, at least not by me, unless it's like a neck fracture or something. Like then we got to go a different route there. But yeah, for a muscle strain, complete rest. Again, like we talked about, it doesn't allow blood flow. It doesn't allow just functional movement. You know, something like just bending over and tying your shoes, like those type of things. We don't want to lose that. We want to maintain some sort of function, some sort of blood flow, and that's why complete rest is just not recommended. That gentle movement, like we talked about, maybe just getting on a bike, you know, going for a walk, that type of stuff, something that's deemed appropriate for the muscle strain at hand.
Mm-hmm.
Um, you know, the complete rest doesn't mean that we don't necessarily modify things. Like I might completely rest you from running,
Right.
right? But we're modifying, but so that we can still move. We should not stop moving. That's the bottom line.
Right. Got it. But the doctor told me to rest. Is there a time when I should rest?
Yeah, it's a whole nother podcast.
Right.
Yeah, and I mean, like I said, you know, when it comes to, you know, maybe like grade threes, you know, and that's
Mm-hmm.
just dependent, because sometimes grade threes, you think if we have like a full rupture of something, there might not be a lot of functional mobility. We have lost function of that muscle.
Mm.
There is, you know what I mean? There is
Yeah.
no pool.
Right.
So yeah, there might be a slight time frame where, um, you know, or again, I say complete rest, but you know, we completely tear the hamstring or something. Maybe we're doing upper body,
Yeah.
but we're doing it seated. You
Yeah.
know, we might not be able to do anything with the hamstring until until it heals or until we figure out surgical route, whatever. But that's kind of, like I said, the complete rest would be just switching gears to a completely different body part that doesn't incorporate the injury at hand.
Got it. Okay. So, and we already discussed what safe, gentle movement looks like, but can you give a specific example? Like if I have a hamstring strain, what might simple, safe movement look like for me?
Yeah.
Let's say I want to get back into sprinting again.
Okay.
What might that progression look like for me?
Yeah, you know, so let's just say it's a grade one, like nice and easy, you know, a little strain. You know, coming in immediately, you know, where you may be getting like hands-on things, right? Or even like, you know, foam rolling is okay within tolerance, that type of stuff. You know, again, getting things moving in and out, in and out. But then, you know, just gentle movement, hamstring flossing, I like to call it. You know, a lot of times people are just laying on their back, hands behind their knees, and they're kicking their legs straight up and back here,
Okay.
right? The goal is to make sure that it's tolerable. We don't want to overstretch an already overstretched muscle,
Mm-hmm.
right?
Mm-hmm.
But that doesn't mean that we can't go from 0 to 90 to start, right? To
Mm-hmm.
keep some sort of functional mobility of the muscle.
Right.
You know, getting on a bike, you know, it's the hamstring should be able to tolerate that. You know, maybe it's a low damper. That's okay. It's still movement. You know, those type of things. You know, am I isolating the hamstring? Are we doing hamstring curls in the first week? Probably not.
Okay.
But that doesn't mean I'm not. Maybe I have them standing and bending their knee and doing like a non-weight bearing or non-loaded hamstring curl.
Okay.
You know, and it depends on the person, depends on the tolerance.
Yeah.
You know, if that's creating 10 out of 10 pain, that's a red flag.
Right.
That's, you know, we're not there yet. But yeah, it doesn't mean that they can't utilize their knee and hip, right? Maybe we're just not loading it immediately.
Got it.
And once we get past that pain phase, that inflammation phase, that acute phase, then we do start to load it. Then we are adding a light band hamstring curl.
Okay.
You know, and then we're moving in eventually maybe some Nordic hamstring curls down the road.
Okay.
You know?
Got it. So we're basically looking at grading the movement that we do based on pain and then also not overstretching, just being cautious with that.
Yeah.
Yeah.
No matter what.
No matter
Whether
what.
it's grade 1, grade 3, you got to allow the fibers to heal.
Right.
Yeah.
Gotcha. So you got to stick with that specific time frame that the fibers actually take to heal. because our body doesn't work with like how we do a skill. We may learn a skill within 2 8-hour sessions, but our body doesn't heal that way. We may be able to pack in a lot of training within a certain amount of time, but at the same time, it still requires a certain length of time for the tissue to actually heal. Biology is undefeated.
Yeah,
Okay,
we
so
can't
listen to your biology.
only change it so much.
All right. Now, getting into the next point, ignoring the injury. So that is another mistake. So explain that. I
Yeah.
mean, it's pretty self-explanatory, but let's
Yeah.
dive into it.
But I mean, yeah, I mean, like you said, it's like ignoring, like let's, for example, ignoring the injury. You have a hamstring strain, and you're a gymnast, and and we're sitting in full splits.
Mhm.
Yeah, so like, yeah, ignoring the injury, and the problem with, so like you said, ignoring the injury, pretty self-explanatory. But the problem with ignoring the injury is, number one, it may not heal. Right. And if it does heal, it's going to heal incorrectly. And
Yeah,
that's where we
yeah.
talked about the whole
Mhm.
organization, right?
Yeah.
If it heals incorrectly and we go back to our normal loading, we're either going to restrain, right? Or we're going to have a bigger injury in the long run, because disorganized tissue is weaker than the organized tissue.
Mhm.
So, maybe next time we have a tendon rupture,
Yeah.
and that's where it becomes super detrimental with ignoring your injury.
Got it. So making sure like basically people can ignore it and then feel better, but that doesn't mean the healing process actually was appropriate. It didn't heal appropriately in order to make sure we don't have another injury down the line,
Yeah.
or at least reduce our chances of another injury.
Right.
Yeah.
Right. Exactly. I think it's like, the body is amazing, right? It can heal itself. Unfortunately, it's really, really good at compensating,
Hmm.
which is great in survival
Yeah.
issues, but not great when we're healing from an injury.
Yeah.
So, like you said, like not everyone, sometimes the pain will linger, and then it's like, okay, well, you shouldn't have ignored it,
Hmm.
but sometimes, healing will eventually occur, whether you ignored it, delayed it, or not, and you don't have pain,
Hmm.
which is almost scarier,
Yeah.
because now you're like, oh, I am perfectly healed, and it's
Right.
not, right? But yeah, like you said, the body is amazing in the sense that it can remove the pain, it can heal it, lay down some scar tissue. You won't even know that it's weakened because it feels fine.
Hmm.
Everything feels normal until you go to sprint and blow your hamstring out again.
Right. Got it. And so I was just thinking, what would be, because people may be asking, how do I know if it didn't heal appropriately? Is it that I have less strength or I feel more imbalanced with this movement? Because sometimes I'll see it often, like people will rest for a little bit. They're just like, yeah, I just tweaked this. I'm going to rest for a little bit. And then they'll go back to something and then they'll feel fine. But then they'll do another movement and something else may happen. Right. So
Mhm.
it's like, oh, now I have another injury, so, but it could have been a compensation from the actual weakened tissue,
Yeah, yeah,
right?
and that's where, again, the body is really, really good at compensating. Again, great thing in survival,
Yeah,
instances,
yeah,
not a great thing when it comes, yeah, because like you said, even though, the hamstring may not have healed well, it may not be another hamstring injury that becomes a problem. It
right.
might be that now we injure our knee, you know
Hmm.
what I mean? Or maybe we tear our Achilles,
Mm,
you know what I mean?
yeah,
Because the body is going to compensate, and, movement patterns are going to change,
yeah,
which means other structures are going to be loaded in a capacity that they are not prepared for or not meant to handle,
yeah,
and then we get another injury,
mhm,
right? And
yeah,
now we're looking at almost two injuries,
yeah,
because even though the hamstring healed, it didn't.
yeah.
It's still injured, and now we have a torn Achilles.
Oy,
Yeah. So
gotcha.
that, and now you have tacked on months to your rehab process, right?
Yeah. So, that just led me to another question that I feel like might be relevant for some people who might have ignored an injury in the past or just recently decided to rest and do all those other things, and now their injury didn't heal appropriately. They may wonder, like, so what do I do in my instance now? Is
Mhm.
there any way to kind of remove the scar tissue? Is there any way to reorganize? At this point, is there a certain point to where I'm just gonna have to deal with the consequences?
Yeah. So, I mean, very, very instance dependent, right?
Mhm.
But this is where kind of the rehab process gets fun,
Mhm.
right? So the way that we have to allow scar tissue to lay down, right? That is kind of how the body heals.
Right.
It's disorganized, cool, but this is where we start to implement our progressive loading,
Mhm.
right? Because the loading aspect of things is how we get them to remodel, is how we strengthen the muscle, the tendon and whatnot. So this is where it gets fun. However, it has to be progressive. You know what I mean? This is not where we implement our 1 rep max back squat. It
Mhm.
is specific exercises that are lengthening we're going to stick with hamstring as an
Yeah.
example, that are lengthening the hamstring, forcing the hamstring to contract and to work. Tempo work, right? Eccentrics are huge when it comes to these type of injuries, but then progressively loading them. And that might mean progressively loading, increasing the weight over the weeks, changing the rep scheme over the weeks, adding a tempo, changing the eccentric. Maybe we start with a 2 second eccentric and then we move it on to, throughout the weeks, we make it a 6 second eccentric, those type of
Yeah.
things. So there's a lot of ways to progressively load, but that is how we remodel, which means reorganize the fibers, the tendon, the muscle, whatever.
Okay, gotcha. And when we say eccentrics, what we're talking about is the lowering phase, and that's the phase to where that muscle stretches out and lengthens a lot. So eccentric, elongate, and where that muscle lengthens out. So that's just making it more. It's making it stronger in that lengthened position. But of course, like we just said, you want to be very mindful of how you decide to load that when it comes to the eccentric. So really starting with lighter loads and then working into more complex or heavier loads as you continue along the rehab process. Um, so kind of give us I know you've had plenty of hamstring strain patients in the past. Let's talk to that population who may be in the gym and
Mhm.
have a hamstring strain. What would that actually like look like? Let's say a grade one
Mhm.
hamstring strain. They want to get back to deadlifting. Maybe they want to get back to some toes to bar or something like that in the
Mhm.
gym. What would it look like for that person?
Yeah, so again, the time frame will be a little bit dependent on how you progress individually. But you come to me, we're first kind of assessing the movement that you do have, right? The amount of pain that you are in, the amount of inflammation that there is, all these things. But starting you with gentle movement, that's pretty. It's a pretty good place to start. Grade 1, grade 2, whatever. Um, Gentle movement within a tolerable range of motion where we don't feel like we are overstretching the injury. Okay, hamstring flossing, getting on a bike, those type of things. We're not likely not doing a lot of toes to bar type stuff. We're not doing a ton of deadlifting RDLs yet. That's not phase one, right?
Okay.
Phase one is gentle movement, trying to get you out of pain, controlling swelling, maintaining functional range of motion and function of the limb in general.
Okay.
Okay. Then we start moving into what we call isometrics. So this is kind of another, it's not an eccentric, it's an isometric, meaning we're producing muscle tension without actually moving the joint.
Okay.
You know what I mean? So for like a hamstring, I'm sitting people on a bench or something, and I'm putting something behind their heel and making them kick back into it,
Okay.
right? Cool thing about isometrics is number one, we're not actually moving a joint, so it's a safer manner to start versus like the eccentric elongating these tissues, right?
Yeah.
We're activating the tissue, but the person that's doing it has full control. So
Mm-hmm.
they control how hard they push.
Okay.
They control how much demand they're putting. Of course, I'm trying to educate them that the demand should not be causing 9 out of 10 pain.
Mm-hmm.
But yeah, they have full control, right?
For you people with high pain tolerance,
Yeah,
trying to speed up the rehab process. If I
no,
push harder, then I'm gonna heal faster.
not gonna happen. Yeah. But yeah, isometrics are a great place to start. And this is, during this time, we are still incorporating gentle movement. We are still trying to get a little more range of motion in whatever body region that needs, each week. That's ongoing. Okay, isometrics. Your isometrics will start to turn into concentric movement, we'll say, right? And concentric is unlike eccentric. It's the phase where we're kind of contracting the muscle and almost shortening it.
Mm-hmm.
So, like for a hamstring curl, it would be the curling movement,
Mm-hmm.
right? So we're starting to do some isometrics.
Okay.
Isolating the quad, but we're also working other things. We need to work the hip. And this is also where we start to maybe determine some sort of a root cause. Were we
Mm.
compensating for something that
Ah,
we need to address?
yeah.
That's where we start addressing this. And then, of course, we progressively load. We progressively start loading our concentrics, our eccentrics, and getting back to deadlifts and back squats and toes to bar, where we are lengthening this tissue under weight in a progressive manner.
Got it. Okay. So we just basically gave you an example of what the progression would look like if you were dealing with some type of strain. And just to kind of recap is, assessing what you can actually do first and foremost, and just building from there. And it's always just monitored by like your pain response, what you're capable of at the moment, and then moving along the line from there. And then also keeping in mind the healing process and how long that may take. So now we're going to go into the fifth and final mistake, which is not addressing the why. And you kind of hinted at that towards the end, finding the root cause. So not addressing the why. Why is that a mistake?
So, I- 9 times out of 10, there is a reason that this occurred. We can't control traumatic events. They happen, and sometimes they result in tears and ruptures and whatnot. Is there a why to that? Maybe, maybe not. Like I said, but traumatic events, they happen. When it comes to if I have a sprinter who has been sprinting for years and years and years without a problem, and then all of a sudden one day blows his hamstring out, making me think that there's something more going on, right? That
Mhm.
wasn't a traumatic event. It
Mhm.
wasn't like he just, got off the couch one day and went to go sprint. Like that would make more sense. You can't go from a sedentary
Right.
lifestyle to
Yeah.
a, dynamic like that. But yeah, so he comes to me and I'm like, that's interesting. Like that all of a sudden one day, like, so what has the body been compensating for
Hmm.
over years of time
Hmm.
that finally, it snapped,
Yeah.
or the straw that broke the camel's back, whatever that saying
Right.
is, right? So yeah, so I'm looking at, again, we're gonna stick with a hammy. I'm looking at above and below the injury.
Hmm.
Is there something that was going on at the hip that was
Hmm.
causing weird movement patterns through the hamstring? Was there something going on at the knee, maybe the ankle?
Hmm.
So like you said, and I hinted earlier, finding that root cause,
Hmm.
because that is ultimately what we need to treat. Once we treat the hamstring and start remodeling it, cool, easy. That part's easy. It's addressing the why, so one, it
Hmm.
doesn't happen again,
Yeah.
and we're basically improving longevity for this
Yeah.
athlete or this person.
Gotcha. And I like to also add with the why just some factors that are outside of just like the actual mechanics of the movement, which can just be how much training you're doing. Maybe that person from that time with the hamstring strain that's been sprinting for years and no issue, maybe they got a new coach, and maybe their coach wanted to implement some new strategy, and then they started training even more, adding even more volume in different ways, overloading some certain areas, and then now you have some type of compensation, right? So just a little overload of volume. Maybe they had a stressful event happen
Yep.
in their life, and then that reduces their overall ability to recover and be fresh for that event. And then they're trying to perform in a highly fatigued, stressed state. And that stress can come from like some type of financial, relational, emotional stress. It can come from not getting enough sleep, right? Maybe you had a couple of nights bad sleep. Maybe you got a newborn or something like that. And then it could also happen from nutrition. So under recovered from not eating enough of the right things. Because one thing that
It's good
gets me,
McDonald's.
we're we're not gonna dive into this too much, but the whole if it fits your macros thing and just eating a whole bunch of junk is not how it works, folks. If you want your body to perform at its best, you need to put in clean, good materials. Just eat whole foods, okay? Just eat whole foods, all right? But we won't dive into that too much. But yeah, so all those other outside factors play a huge part into that whole not addressing the why. So,
Yeah.
Yeah.
Yeah, I mean, that's a good point that you made, and like you said, we don't have to dive into it, but yes, but like as a good therapist, a good physical therapist should be identifying some of these things. Like, hey, like what else is going on in your life,
Mm-hmm.
man? You know what I mean? Like, it's okay to ask. You know, do I have the credentials to if this person needs more support, maybe health service, mental health services, or something like that? Like, no, that's not in my scope, but I can identify if there is a problem that is contributing to the physical
Mm-hmm.
injury, right?
Yeah.
How we address that other problem, right? You know, maybe he's getting referred, or he or she is getting referred to someone who is specialized in whatever they need, right?
Yeah.
But yeah, no, that's a really good point. Like, your physical therapist should be digging like
Yeah.
layers of to what your why is, right? You know,
Mm-hmm.
why do we need to get back to sprinting?
Yeah.
You know what I mean? Do we need to get back? Like, why? I want to know why you know, is it a weight loss thing? You know, which is a
Mm-hmm.
huge why for people.
Yeah.
You know, we need to get down to their why, but we also need to get down to why the injury happened,
Mm-hmm.
which is layers deep. And
Yeah.
your good physical therapist digs.
Yeah. Yeah. That's huge. And I want to add to that we don't, it's not that we have to try and fix that thing, but we can kind of guide that awareness, like bringing awareness to what's going on allows you to know, like, okay, this is something I need to address right now. Because most of the time, in a lot of cases, people can see, okay, I did not realize that this had an effect on my injury. And just like, yeah, like, your body is a complete system. This had an effect on your injury. So you may want to look into addressing that. Maybe setting some boundaries or whatnot with certain relationships that
Stress
maybe,
management
stress
techniques.
management techniques. Those are things that we can definitely guide patients on. Like,
Yeah.
here, just a few techniques to do, getting outside in nature, 5-minute walk, breath work, all those journaling, all
Mhm.
those things we can definitely talk to people about, and you can definitely implement in order to help with those other factors that play into the root cause of your injury. So, yeah. All right. So we kind of went off on that one, but it's very important to
It
address
is.
that part because, again,
People underestimate this.
yes. Yeah. So many patients come into the clinic and they're just like, "Oh my gosh, like my neck is just so tense, it's so tight. I don't understand." And I'm just like, "Okay, yeah, we you were in a car accident or whatnot, and you did have some type of traumatic event happen to your neck. But yeah, you don't sleep at all. You don't sleep that well. Not say sleep at all, but you sleep 5 hours a night and you run on caffeine consistently and you have a stressful relationship and your job is crazy right now. You don't like your manager is always on you. Yeah, how are we gonna add more therapeutic interventions on top of that stress load that's supposed to help you get better when you have all of these things going on? We gotta take away some of that stress load so we can add some stress load
Right.
in order to help you with that injury.
Correct.
Yeah. So I'll just leave that point at that. Um, okay. So I think another question I wanted to have here is, and what are some strains that could be avoided, or so? What are some ways that strains could be avoided? So I want to say we were talking about mechanisms. So one of the things is warming up appropriately.
Yeah, for sure. Absolutely. I mean, that goes with for any injury, right? So warming up, and not just like hopping, like getting warm, right?
Mm-hmm.
You do want to get warm. You want to get the blood flow going, right? But your warm up should start to incorporate maybe something that you're compensating for. Like, if
Mm-hmm.
you know, like, you have a hip mobility issue, then if we're gonna try and go sprint, we should be opening up our hip and then stabilizing the hip with some sort of strengthening stabilization type thing, right? So yeah, the warm up's huge in regards to getting the blood flowing, but also priming the area to function optimally with whatever you're doing. Right? You want to
Yeah.
prime the specific, if I'm sprinting, do I need to prime my rotator cuff as much? Probably not. But yeah, I should be priming my hip and my hamstring and
Yeah.
my quad, and you know what I mean? I got to prime these things so that they function optimally when I go to use them in a rapid manner,
Right.
you know?
Okay. So make sure you warm up, folks,
Yeah, whether you're
properly.
20 or 60, warm up.
Make sure you warm up appropriately. So priming areas, looking at your weak points, the root cause of what may be going on. As long as you know what that root cause is, and you're not just kind of like throwing darts at the board or whatnot, And that's a big issue with following online programs or an exercise you may have seen on social media, or if you just Google something and you're just like, oh, hamstring strain. All right, what do I do with a hamstring strain? And then you see on Google, and they're definitely going to tell you to rice.
Yeah.
If you've seen
Yeah.
any Google searches, you'll see it'll say rice. But then also programs, because again, you don't get a proper assessment from those programs, at least from the ones that I've seen out there. And then exercise. Yeah, we give out exercises as well, but we also try and like add in a little bit of, hey, if you're dealing with this based on this. So if you know that, okay, I have knee pain from instability of the hip, then you may want to do this. If you have knee pain from mobility of the hip, then you may want to do this. So, but if you get a blanket statement, somebody saying like, oh, if you have knee pain, do this one thing, then it can, I see it often that it just discourages people from continuously like moving forward. They feel like they've done everything already, all the exercises, but they actually didn't address the root cause.
Yeah, exactly. Yeah, a lot of those blanket programs, like they can be. It's not to say that they can't make your hamstring strain feel better.
Hmm.
They may. You know what I mean? It's not to say that they're not progressively. But they can't address your individual why, your root
Hmm.
cause as
Yeah.
to why this happened.
Yeah.
That takes a good physical therapist digging
Yeah.
and figuring that out.
Yeah. And the programs, once again, I'm not saying they don't help. It's just that
Mhm.
how they tackle the issue is the main point. So if they tackle it from a holistic standpoint and they're trying to tackle from a broad perspective root causes of what might be the underlying cause, shameless plug here. Redemption, we do have programs. And it's a
We do.
holistic approach.
Right.
It tackles like, okay, what may be contributing factors to why you got that injury in the first place. So for hip mobility or hip stability, it hits on hip mobility, hits on hip stability, all in the same program, ankle and ankle stability, ankle mobility, and then also strengthening the area that's actually injured. So it's tackling the whole entire chain to make sure no stone goes left unturned. But if I were just to give you a program that just had exercises that were specific to, let me just say, the hamstring, and it was just a whole bunch of hamstring exercises, that's not the holistic framework. So if you do decide to look at programs, make sure it does tackle like the whole
Mhm.
spectrum or whatnot. Maybe you can't afford actual like assessment at the moment, or maybe you're out of range of a good physical therapist. Then you're just like, okay, like how do I actually rehab this thing? You can listen to podcast episodes like this. You can watch other videos that may explain the mechanism of the injury, or you can get holistic programs. And then also you can get a virtual assessment. Again, another shameless plug.
Right.
Look, we gave you all the info. I'm just letting you know the resources that you do have available to you. But yeah, you can get a virtual assessment as well. Like there are ways to tackle your injury. So, is there anything else that you wanted to add to the whole hamstring strain, or not just hamstring strain, but muscle strains and the mistakes?
Yeah, no, I think that your last point was great. Like I said, the holistic approach, taking lifestyle factors into play, finding a good PT, like these are all things that are depending on your why and how badly you want to get back to whatever you're missing out on. These are all things that you need to look into.
Yeah, for sure, for sure. And so we want to hear from you too. So if you are currently dealing with some type of muscle strain and you just can't figure it out, put it down in the comment section. If you're watching on YouTube right now, if you're listening, go to YouTube, put it in the comment section, reach out on Instagram, send us a message or whatnot, DMs. But let us know what's going on. And then also, what else would you like to see from us, so that way we can actually give you the information that you need in order to make sure that you're able to continuously live your active lifestyle without all these constant nagging aches, pains, and injuries that go along with not approaching rehab and therapy appropriately. So, if you want to learn more about how Redemption Physical Therapy can help you get out of pain and take your performance to the next level, be sure to go to redemptionphysicaltherapy.com or simply click the link down in the show notes. And again, thank you for listening, and we'll see you in the next one.